Hello, I'm Dr. Bjorn Peterson with Regions EMS. I want to share a few updates with you regarding infectious disease preparedness in light of recent Ebola cases in the United States. This outbreak is a dynamic situation and new information is continuously becoming available. This video represents information we feel is accurate at this time, and we recognize that recommendations made by the CDC and the Department of Health will continue to be updated as the situation requires. Here at Regions EMS, we have put together a few suggestions for EMS providers and agencies as you prepare for and respond to potential Ebola patients. First and most important is to remember the two questions we must ask of a patient before we should suspect Ebola. First, does the patient have a fever over 100.4 degrees Fahrenheit? And second, has the patient recently traveled to a West African country? Only when the answers to both of these questions is yes, should we implement Ebola precautions. This patient would also be referred to as a double positive patient. Ebola precautions should include disposable gloves, a disposable gown, either impermeable or fluid resistant, eye protection, which includes wraparound goggles, safety glasses, or a face shield, respiratory protection, which should always be worn with eye protection. The lowest protection would be a standard surgical face mask. Better protection would be an N95 filter mask. And the best or highest protection would be an air purifying respirator, otherwise known as an APR. Some models are powered, which are referred to as a PAPR, and may be a half face, a full face, or a hood type model. Other components for high volume fluid environments would include disposable boot covers or shoe covers, and disposable hair bonnets. For patients who are critically ill, or for patients who we are unable to screen for fever and travel, such as cardiac arrest, we encourage the use of face protection and diligent body fluid precautions as the situation warrants, especially for patients requiring airway management. Patients with a fever and recent travel to West Africa are not likely to be in serious distress when accessing EMS for treatment. This is important to note, as it means we can slow down our process and take time to ensure our own personal safety. Donning the appropriate personal protective equipment requires EMS providers to use a buddy system. This ensures that your partner checks your PPE before you initiate contact with a potentially infectious patient. Upon doffing your PPE, this buddy also helps to ensure that no cross-contamination occurs. This doffing process is the most critical and high-risk process of using PPE with infectious patients. Please take a moment to become familiar with the CDC recommendations for donning and doffing PPE. A link to the CDC document is available on our Regions EMS Facebook page. If you transport a patient suspected of having Ebola to a hospital, be sure to notify MRCC of your suspicions and of the patient's signs and symptoms. The operators may also prompt you to ask the two screening questions mentioned previously for patients felt to be high risk. MRCC will then provide instructions related to accessing the destination hospital. This may include waiting in your ambulance until a hospital representative comes out to escort you to the appropriate area. After delivering your patient to the ER, you should follow your agency's guidelines for disinfecting your equipment and your ambulance. Keep in mind, the Ebola virus is easily killed with bleach and other hospital-grade disinfectants. Depending on your agency's policies, you may be quarantined at the receiving hospital. The State Department of Health will be providing guidance to agencies on such policies. I know there are still many questions surrounding best practice in the prevention and care of Ebola. We at Regions EMS are committed to providing you with good information as soon as it becomes available. Please continue to work with your agency to understand and practice good personal protection against all infectious diseases. Though Ebola is in the headlines now and is a real issue, we want to remind all EMS providers of the constant and real risk of many other more common infectious diseases encountered on a daily basis. Hand hygiene, use of personal protective equipment, and receiving an annual flu shot are all critical components of good self-care.